Thank you very much for all of you, and especially to Jacob and Jean-Luc. I'm going to talk about my country. My country is a 15 million people country, similar to Peru and Argentina, less than Mexico or Brazil. And I'm going to talk about the cervical cancer situation, talking about the magnitude of the social and economical burden of unhealthy lifestyles, predisposed to cancer and non-communicable chronic disease. And the problem is only a few countries has done a positive stride against the tobacco, the salt diet control, and HPV vaccination. Worldwide, the, the place where cervical cancer is located is in the fourth place. But for our countries, the situation is different. We are above the media of the world. Colombia and Mexico are similar, so different than the United States, but not so worse like Bolivia, where the incidence and mortality are so high. And if you compare the incidence in my country, the cervical cancer is in the third place, about 2,000 deaths per year, and the incidence and the probably is 4,000 new cases per year. And in our country, the situation of the cervical cancer is in the third place. And if you see the relationship between the development index and cervical cancer incidence, according to many continents, we have in Colombia is not so worse, but it's not so good. If you compare, Africa is the worst in incidence and mortality, and probably Europe is in the best place. And according to the mortality is the same situation. We are probably in the middle of incidence and mortality. Colombia has implemented since 2012 a plan for 10 years for the control of the cervical cancer, with the modification for many risks, for improving early detection, the care, the recovery, and overcoming damage, improving the quality of life cancer patients and survivors, information system for the decision making, and human resources for cancer control. Is similar to the goals of the WHO goals from 2020. And many goals for cervical cancer. The most important is to achieve the 80% of the population object. The women aged between 25 and 69 start in 2013. But the problem is we can't reach this 80%. We do obviously see and treat a strategy in many places, but the problem continue, and the cervical cancer situation is increasing in my country. If we keep doing the same, the problem is not in Colombia, it's in the Americas and worldwide. We are going to have a 25% of increase of cervical cancer cases in the Americas at least. For that reason, we are joined to the architecture of the elimination of cervical cancer to the WHO. What is going on with primary prevention in my country? We have a national program in immunization, inclusive. In October of 2023, we implemented a gender vaccination. It was an important step for us, but the problem, as usual in many countries, is coverage. Our coverage for the first doses is low, and for the second doses is low, more than the first dose as usual. And now we implemented one vaccination dose from October 2023. In secondary prevention, we are joined obviously with the WHO strategy, but the problem of a country in Latin America like Colombia is we have a very big problem from barriers for the cytology screening or HPV screening, because half of the country is in the jungle with the little towns, very, very poor little towns, close to Venezuela, to Brazil, to in the borders is where we have the biggest problem for screening. We add obviously to WHO management guidelines for screening and treatment, and we implemented in the big cities the HPV DNA detection as a primary screening test. But the problem is our country is not so rich to have HPV for everybody. So in many places of my country, we are based on conventional cytology, either liquid-based cytology. For these problems, IFCPC implemented our IFCPC distant learning course. Our distant learning course is a course with the EARC, and is a structured, progressive, comprehensive, and accessible program. Includes theory, images recognition, case management, and clinical modules, assessed continuously during the course by an OXI exam at the end, with a certificate of completion of the course and passing the exam. I am going to show some examples, the course in English, the course in Portuguese, and the course in Spanish, but we have the course in French also. This is the content of the course. I am not going to see all the course, but you can visit our webpage, www.ifcpc.org, and you can see the course. It's a very easy and it's a new course, and it's very important for young people and for the older colposcopists who want to give an update to their knowledge about cervical pathology. Conclusion and challenges. Among the social determinants of the cervical cancer mortality is the average of number of years of education of the population, income levels, and the difficulty of accessing technologies for prevention, diagnosis, and treatment. The vaccine has been implemented in low and middle income countries with different strategies and problems of acceptability, particularly in Colombia. Few countries have managed to implement the new screening strategies for HPV. For low and middle income countries and regions, visual inspection techniques are an important alternative. The new molecular technologies generate challenges in the management of guidelines and in the quality of colposcopy. And some important tools are now available for improving cervical cancer prevention. Boost secondary prevention, testing the presence of HPV in cervical specimens and treating HPV-induced lesions. Introduce primary prevention by immunizing against a select group of oncogenic HPV types. And nowadays, strategies that combines HPV vaccination and HPV screening have to be evaluated. And the final question is, it is possible to eliminate cervical cancer in the medium term proposed by WHO? I say it's very difficult for countries in Latin America because the first 90% that is vaccination We are so far to achieve the goals. In many countries in Latin America, for the first dose, are between 40 and 60%. So with this strategy, we never reach the 30% of reduction in 2030, at least for Latin American countries. Thank you very much for your attention, and it was a great opportunity to participate and to show my country. Thank you very much.